Which of the following is a CLIA waived test commonly performed in the physician's office? Now, CLIA stands for the Clinical Laboratory Improvement Amendment, and it's a U.S. federal regulation that's used to create quality standards for specific laboratory testing. And this usually involves more complicated testing, where there's a lot of different steps involved, and the lab needs to maintain specific guidelines, to have specific training for personnel, or specific equipment used, because it's a more complicated test. Now, this question is asking which is waived from CLIA, so which test is a more simple and a less complicated procedure that does not need any sort of CLIA guideline regulation. Now, looking at the choices, we see a blood culture, a chromosome analysis, a tissue biopsy, and a urine analysis. So we want to see of this list which is the least complex and therefore does not need to have CLIA guidelines and is waived from this testing. Now, anything that has a culture, like a blood culture, urine culture, is more involved and more complicated. We need to find out which bacteria are specifically involved, if there is some sort of infection, and that's a more complicated test and therefore would not be waived by CLIA. So we could eliminate that. Option B is a chromosome analysis, and option C is a tissue biopsy. So we see chromosomes and we see a biopsy. So a biopsy is a specific sample that needs to be tested from a tissue. So it's from the patient's body. So that is a little more fragile. That needs specific guidelines because it's complicated as a biopsy. So we can eliminate option C. And then option B is a chromosome analysis. So it has all the genetic data from the patient that needs to be analyzed. And that definitely needs specific regulations and specific testing. You need someone who has an extensive background in genetics to be able to analyze the chromosomes. So we could eliminate option B as well. And that leaves us with the urine analysis. And the urine analysis is a very standard and routine test that's performed in the office. And oftentimes it's just using a dipstick, meaning that you're using kind of like a piece of paper that you're dipping into the urine and comparing the colors to the key to see what features are shown in the urine. This is different than a urine culture, which has to do with specific bacteria and is a little more complicated. Therefore, the UA is a very standard procedure that we see in a physician's office and is not part of CLIA and therefore waived because it's a simpler, less complicated test.